is Dominique IM INJECTION, and this is my I Am injection video. The first thing that I'm going to do before beginning this procedure would be to wash my hands, to gather my equipment. What I need here is some alcohol, swabs, this IM needle, which is 21 gauge, 1 inch, and it is 3 milliliters in capacity. I have this vial of medicine here, my MAR sheet, and some gloves. I'm going to go over here, ask the patient to verify their identity. Hello ma'am, my name is Nurse Dominique. I'm going to be helping you today. With your IM injection, can you verify your name and date of birth? I would compare that to this bracelet here. I would also ask if she has any allergies. Even though I see this here, I have to ask. And it says here PCN, and it's probably penicillin, and that's not what she's getting today, so all is good. I'm going to come back over here and begin drawing up my needle of medicine. So I'm going to clean the top off, get any germs, bacteria off of it. Rewind a little bit. So this isn't a medicine drawer. When I pull it out, that's when I do my first of 3 different checks. So check this is the correct medication. So I pull it out, compare it to the MAR. Compare the name of the patient that's on the label here with the sheet, and compare the medicine that is on the sheet. The second check is going to happen as I'm preparing it. I'm going to wipe it off here, make sure that it's the same. And then the third check happens before I inject it with the patient. So here we go. The top is cleaned off. Done 2 of 3 checks. And now I'm going to put some air into the needle. 2 milliliters. Okay, now that 2 milliliters of air is now in the vial. I'm going to pull it back. Big, huge bubble. Okay, so about bubbles. If they're at the bottom, I can tap to get rid of them. This bubble is at the top, so I'm going to pull back more medicine than I need, and then slowly push it up, and that got rid of it. So yeah, if they're at the bottom, tap it and get it to come to the top. Once it's at the top, pull back more than you need. Don't want to inject here. Okay, I'm going to put my gloves on. And grab one of these pads here. This is a good time also when I'm about to do this injection. This is a good time to sort of assess the patient's knowledge of their medications, and it's sort of asking, do you know what you're getting? Do you know why you're getting it? Do you know the side effects? If they don't, this is a perfect time to explain it to them. If they do, then just awesome, good job, you're doing well. So where I'm going to put this is the vasogluteal site. It's right here. The way that we find exactly where it goes is you put your heel on the greater trochanter of the hip, right over here. Here, I'm going to move this for a second. You put your heel of your hand on the greater trochanter of the hip. The thumb goes to the groin. The index finger goes towards the top of the hip here. So you sort of get right around here. As you can see, there's a V made between my fingers, between my index and middle finger. In the middle of that V is where the injection is going to go. So I can clean the area. Okay. Some since this is a mannequin, I can't inject that. We're going to use this nice pad here. And it has been cleaned. Okay. 1, 2, 3. Goes in. Aspirate to make sure that there's that I'm not hitting any blood vessels. I don't see any blood. And then I would push it all the way down and then pull it out. Okay.
Okay, go.
Okay, so I just did the injection. I'm removing it now. Hold some pressure on it. Ask if there's any pain. Ask the patient, and she says no. So I can bring this back. Cover her back up. All right. I would dispose of this in the sharps container right here. I'm not going to actually throw it in because this is my needle that I practice with. So let's just put it there. At this point, all you need to do after I clean up all my mess and everything is make sure that I document what happened really well. So I would say like the time that this injection happened, why the patient was getting the medicine, like patient diagnosed with blah blah, patient received 2 milliliters of whatever medicine it was, and then I would also note the site. So I put that on her right side with the vasogluteal site. And then I could report also if the patient had any pain or with it, or some sort of reaction. Yeah. So then I have the objective information, subjective information. I think that's it.